Yes. So here we are. We are starting on the session now. Yeah. So Aisha Chaturani and Dinukshi Liyanage. So both are regular students. So this session is for you. So get ready for the show. Right. So this is series test number 1. Okay. This is test number 1, listening, series number 1. So you go on watching all these series, one after another. They will be regular. Okay. Extract 1, then extract 2, then part B, then part C, extract 1, then part C, extract 2, like that. They will be in continuation, whether you are there or not. If you're not there, let me know. Okay, I'll provide you everything. So, attend the sessions regularly whenever I give you all these things. All right. So, now here we are. This is the extract. Number 1, the questions 1 to 12. Okay, questions 1 to 12. Yeah. Extract 1, questions 1 to 12. You hear a physiotherapist. You hear a physiotherapist. Okay. You hear a physiotherapist talking to a new patient. The patient is new, first time. Okay, fresh patient is coming for the first time. And the patient's name is Ray Sands. The questions 1 to 12. So what you have to do, the instructions, these are the instructions. We call them instructions. For the questions 1 to 12, so there are 1 to 12 questions, and you have to complete the notes. So this is notes completion with a word or short phrase that you hear. And this is the time limit. You have 30 seconds to look at the notes. This is the demarcation between pre-listening and listening stage while listening. So pre-listening, that means this 30 seconds time, there will not be any audio. It's a silent zone. That's a silent zone. Okay. It means it's a silent zone. Right. So if that is the case, okay, if that is the case, that means you are supposed to only listen. So this 30 seconds, what you have to do, I'll tell you. So here are the questions. So what is the name of the patient? And this is the past history. Okay. This is the past history. 18 months ago, 1 year ago, 6 months ago, last month. So 18 months ago, back injury sustained. So try to understand this one here. Back injury sustained 18 months ago. Okay. 26, yeah. And 1 year ago, sciatica developed. 1 year ago, sciatica developed. All right. That's clear. And then 6 months ago, clear of symptoms. No symptoms. Clear. Everything is clear. But now, last month, recurrence of symptoms. So what do you understand from this? So 1.5 years ago, there was a back injury. And after that, 6 months, that is 1 year ago, sciatica developed. Okay. Then 6 months ago, symptoms were lost. So see here, every 6 months there is a last month recurrence of symptoms. So 1.5 years ago, he had an injury, back injury. Then after that 6 months, sciatica developed. Then after 6 months, symptoms were cleared, sciatica symptoms, everything were cleared. Then again last month, the recurrence of symptoms. So this is all about past history. Now you see lifting something. Lifting something. So this is the first answer. Okay, forget about that. Next one, patient's descriptions of symptoms. See how the skeleton is moving. For example, this is head. From head, where head ends, there will be body. And where body ends, there will be limbs, hands and legs. So this is the way how demarcation, separations are there. So first one is past history. Then this is patient's description. So symptoms. So this is symptoms. You can see the symptoms. You can understand it very clearly. The symptoms. First one is history. Second one is symptoms. So you can separate these things like this. So let us separate. We will make some demarcations. So first one is the extract. Yeah. So that is the extract. Yeah. Yeah. This is the extract. Yeah. This is the extract. In the extract, we have the first zone. This is the information zone. We call this information zone. In the information zone, we have two things. First one is the background, and second one is the time frame. So that's very clear now. Okay. So you hear a physiotherapist talking to a new patient called Resans. So this is called the background. Who is the medical professional? The medical professional is the physiotherapist. And this is a consultation. This is a consultation. So in this consultation, the physiotherapist is talking. He is talking to whom? He is talking to the patient. So now this patient, is he new or is he old? So is it second visit or the first visit? That's what you are seeing. So this is the first visit because this is a new patient. You can see there. He is a new patient. That means first time visit. First time visit. So he is visiting this particular doctor for the first time. He is not repeating the visit. It's not a second time. It's a first time. Right? New patient. And the patient's name is Ray Sands. So what do you find here? There are some things which we find. What are they? Number one. Number one. So this is the background. In the background, we have some important information. What is that information? Let us see here. Number one. So what is the background? Okay. Background. That's number one. Number two, who is the medical professional? Number three, who is the patient? So these are the three things. Okay. So background, this is a physiotherapist's clinic. Medical professional is the physiotherapist. And the patient is Mr. Ray Sands. Okay. So he's the patient and his name is Ray Sands. So these are the things that you're going to listen here, find out here. The next one, the next point is the information regarding the test. There are 12 questions. The fourth point is 12 questions. So how many questions are there? Questions. Questions or 12. And task. What is the task? The task is, this is a notes, and you have to complete the notes. So notes, completion, activity. So the notes is incomplete. So you have to complete the notes. And how you have to complete, that is the manner. Manner. What you have to do? You have to use a word or short phrase. And where will you get this information from? Can you use your own information? No. You have to take the notes, information, okay, based on the audio. So audio, what the audio is giving you information, that information you have to catch and you have to write. That's the clue. That's the clue. These are the things that you have to follow. So 7 different things. Now the time. Next one is the time, 30 seconds. So the time. So this is called a pre-listening phase. Pre-listening phase. Now in this pre-listening phase, you have how much time? 30 seconds in all. 30 seconds for 12 questions. That means each question you have how many minutes, how many seconds? Each question 2.5 seconds, means 2.5 seconds. Okay, each question you have 2.5 seconds. It's very big time. It's very big time. So 2.5 seconds. So now we come to the body. We come to the body here. Now you see, right? The body we are going to divide into phases again. Okay. Now the first one is history part. This is the history. 1.5 years, months ago. So 18 months ago. 1 year ago. 18 months is equal to 1.5 years ago. That is 18 months ago. So 12 months ago. That is equal to 1 year ago. 6 months ago. Half a year ago. Last month. So this is what happened before. So this is past history. And patient's descriptions of the present symptoms now. Now. Okay. Right. So present symptoms. So let us take this one. Symptoms. And next one, treatment. Okay. This is treatment. Initial treatment, referrals, further treatment, and previous diagnosis. Okay. So he's talking about the treatment. What happened? Fine. Let us see all these things. Now raise hands is the name of the patient. Back injury sustained while he was lifting something. Next, 1 year ago, sciatica developed. Yeah. 1 year ago, sciatica developed. Then 6 months ago, clear of symptoms, and last month, recurrence of symptoms. Now, patient's descriptions of symptoms. Pain located in. So, pain located in which body part? Pain described as, the description of the pain, what type of pain it is. The next one, loss of mobility. Problems of sleeping. So, mentions inability to do something. So, problems of sleeping. So, maybe it is related to that one. Okay. The next one mentions inability to. Next, dash sensation. What type of sensation? Type of sensation. Adjective. General numbness in the affected area. And occupation. What is his occupation here? So involves travel, some manual work, like maybe salesman or a delivery boy or a tour guide, something like that. So next one, initial treatment. Prescribed NSAIDs, application of something. Something means noun, some relief. He got some relief with that. Then referrals. dash briefly name of some medical professional. So here is another referral, that is sports injury specialist. Here also some other, maybe podiatrist, maybe neurologist, maybe something else, okay, related to the problem, sciatica. Then epidural injections. So referrals, then further treatment, epidural injections. Then what he had, what type of treatment he had? One, this is number one, and this is number two, which we have to listen and write. And then third one is electrical impulses. And fourth one, he decided not to try something. Okay, what is that? So patient attributes recovery to recovery. How he recovered, what made him recover. So he's attributing, he's telling that this recovery is because of recovery due to. So he's ascribing or attributing this recovery to a particular medication or treatment modality. One of that or two of them or all of them, anything. A mixture of all these things maybe. Because he has done all these things, so that's why he got the recovery. So sciatica probably related to what? Okay, a particular thing. Related to is a preposition. Relation to something. Okay, sciatica probably related to something, maybe back, maybe backbone, or spinal cord, or something like that. So reports no history of pain in buttocks. Right. Now coming to our main part. Yeah. So we have gone through these things. Now we are going to see the pre-listening phase. Pre-listening phase. Now go through this pre-listening phase. So what are you going to do in this pre-listening phase? So how to make the best use of this time, 30 seconds for OET listening part A, extract 1. So how well or how effectively you're going to use this time. That's important here. Yeah. So here is a structured guide to help candidates use the 30-second preparation time effectively before the audio starts. So the goal, predict the context. Predict the context. What is that? Who is the medical professional? So where is he sitting? It's a consultation. The next one, who is the patient? What is his problem? So this is the context, means background. And what is the background? Background is a physiotherapist's clinic here. And the person who is responsible is the physiotherapist. And the patient's name is Ray Sands. And the patient is coming for the first time. New patient. So this is how you will guess. Next one, you have to anticipate vocabulary. What type of words you are going to listen. And prepare your ears for target listening. For example, he will say pain in the, where? Pain in the, is it pain in the table or pain in the wall or pain in the house or pain in the roof? No, it's pain in the body, a part of the body. A part of the body. Pain in the right shoulder maybe. Pain in the left leg maybe. Pain in the neck maybe. Pain in the thighs maybe. So like that. So what exactly you are going to hear, you should be mentally ready for that one, and prepare your ears for targeted listening, not just listening. It is targeted listening. You are going to target what type of words you are going to listen. What are the things that you are expecting? Okay. What do you actually want? So based on that one, your listening will go. Now let us see. Now this is something. Go through this one. What to do second by second. So 30 seconds. Proper planning is here. 30 seconds. Proper planning is there. Go through this one. 0 to 5. What to do second by second? 0 to 5 seconds. What are you supposed to do? Glance at the instructions. So first 5 seconds, you have to glance at the instructions. I have told you what are instructions. Instructions are the beginning before the actual questions start. Before the actual questions start, there are the instructions. So glance at the instructions. What are the instructions saying? You hear a physiotherapist talking to a patient. So identify the scenario. Okay. And the participants. Example, there will be a doctor, that is a physiotherapist, talking to a patient. The scenario is doctor plus patient in a physiotherapist clinic, like that. That is 5 seconds. I'll go and describe later in depth what exactly still further you have to do in those 5 seconds. Okay. Just dividing the 4 phases here. Phase 2. This is 10 seconds. You have to scan all the headings and bullet points quickly. Headings and bullet points. Headings and bullet points. Scan. Don't read everything. Just a scan. What are the headings we have seen? Past history. 18 months ago. 1 year ago. 6 months ago. 1 month ago. Like that. Bold letters, you know. Those are called as headings. You have to go through those headings and you have to understand what it is talking. So years and timings and all those things he was telling you. Right. Then next, understand the timeline and progression of events. Timeline. 18 months, 1 year, 6 months ago, 1 month ago. So see the timeline, how it is going. So it will proceed. The discussion will proceed in the same way. So when the answer, for example, if you have the question here, for example, if you are going through this particular point, 18 months ago, that means you have a point. So that means you are going to focus here. You have to focus more here because 1 year ago, no question is there. 6 months ago, no question is there. Last month, no question is there. So when this 18 months ago, when he says, or 1.5 years ago, he says, immediately you have to be very alert because you are expecting something there. You are expecting an answer will come there, not when 1 year ago, not when 6 months ago, not when last month ago, but 18 months ago when he says, be ready, be on the alert because you are getting an answer there. So back injury sustained. He had a back injury. His back injured. He got a back injury when he was lifting something. When he was lifting something. So what is that something? That you have to understand. So you have to be ready with these bold letters, with these bold things. You have to be ready. So patient, 18 months ago, 1 year ago, these are the headings and bullet points. So go through these headings and bullet points very fast. Then patients, descriptions of symptoms. So these are the symptoms. These are symptoms. Then he will tell about occupation. Then he will talk about initial treatment. Then he will tell about the different referrals he had. Then he will talk about further treatment and he will tell about further previous diagnosis. So these are very, very important and you have to go through all these particular things. Yeah. So these are the bullet points. These are the headings and these are the bullet points. Okay, you have to go very fast in 10 seconds. In 10 seconds, you have to go through all these things very fast. Now coming to the next point. Yeah. So understand the timeline and progression of events, how the events are going, headings and bullet points. Next one, 15 to 25 seconds. You have to focus on the gaps 1 to 12. Focus on the gaps. Focus on the gaps. the grammar before and after each blank. There may be a. A means a singular. Noun will come. An, singular. Noun will come. The, before, singular. For example, the word after the blank is a speaks or a tells. That means the noun is singular. If it is speak, then the noun is plural. So you have to understand by the words before and after using the grammar because of the tense and the vocabulary. What? So note the grammar. That's very, very important. Before and after each blank. So predict a word form. Is it noun or verb or adjective? And what is the tense you have to use? Likely vocabulary. What type of vocabulary you have? Now let us see that once again. For example, application of something or some things which provided relief, something. You applied something, maybe balm, maybe cream, maybe lotion, maybe powder, maybe ointment, maybe heat pack, maybe cold pack or ice pack, whatever. So like this, different things may be there. So you have to guess application of something. Application of ointment. Okay. Application of powder. So application is a noun, of is a preposition. So the next word also will be a noun. How come? Now let me give you an example. A pen on the table. On is a preposition. A pen is a noun. The table is a noun. A pen is on the table. A pen on the table. Pen. Keep the pen on the table. Pen on the table. Keep this pen in your pocket. Pen in your pocket. Pen, noun. In, preposition. Your pocket, again noun. So noun, preposition, noun. This is a relationship you should know. This is a relationship that you have to understand. If you understand like this, it will be very easy. For example, mentions inability to dash. Inability to dash. So inability to move, inability to jump, inability to get up, inability to lie down, inability to turn, inability to bend his leg. So here, to do something, to do some action. So is it past tense or present tense or future tense? It is simple present tense. V1, first form of the verb. To move. It's not moved. Inability to bend, not bent. So first form will come. Inability to fold, inability to get up, inability to lie down. So first form of the verb will come and the first form of the verb will come. Next, pain described as me follows adjective. As means it's an adjective. Okay, as means in a pain located in a body part, like that. So this is the way related to something, some body part. Recovery to something, noun. Not to decided not to try something. So something. So nouns will be more. Next comes adjective. Next comes verbs. So this is the level, intensity of the words usage. You can guess what will come here. Here a noun will come. Here a noun will come. Related to something. Related to something. Recovery to something. So try not to try something. So like that. So application of something, noun again. So here, dash sensation, painful sensation, irritating sensation, itching sensation, something like that. So adjective will come here. Adjective will come there. So this is the way how you will guess whether noun will come or adjective will come or adverb will come. So be careful. Next. So predict word form, what noun or verb or adjective based on the tense or likely vocabulary, what vocabulary will come. These things you have. And last 5 seconds before the audio starts, last 5 seconds, mentally highlight patterns. Mentally highlight patterns like repeated things, repeated words like pain, treatment, referral. So follow the threads. Follow the threads. So what do you mean by following the threads? For example, when he says pain, see, you see, he's telling there. So this is dash sensation, dash sensation. So itching sensation, irritating sensation, or painful sensation, something like pain. Okay, troubling sensation, painful sensation, uh, extreme sensation, mild sensation, moderate sensation. So type of sensation. What type of sensation? Some sort of pain or something feeling. So here, next one, pain as, pain located, pain, pain, pain. You see pain repeated. So you have to follow that thread. Pain located where? Pain described as. Okay. So all these things, follow that thread. That's what he's telling. Next one, during the conversation, you have to follow the treatment. Treatment. Now let us see here, treatment. Now referral. This is the first referral, briefly. Then the second referral, sport injury specialist. So two referrals were given. First one, we don't know, we have to find out. Second one, sports injury specialist. So two referrals. So this is the order. So repetition. The referral, you have two referrals here. First referral, second referral. Second referral is sports injury specialist. So who is the first referral? That will come before sports injury specialist. Next one, treatment. The first treatment is epidural injections. The second treatment is something we have to find out. The third treatment is electrical impulses. The fourth treatment is decided not to try. So he told something, but he said, no, I don't want. So four type of treatments, okay, modalities the doctor has recommended, treatments, okay. So he said first one, epidural injections. He had some problem maybe. The next one, something else. So what is the third? Electric impulse. So second type of treatment you have to know. And fourth type of treatment, he decided not to try. Okay, decided not to try. So doctor said, go for this one. But he said, no, I don't want to do this. Or the patient only says, I don't want to do this, something like that. So there are four treatment modalities here. So out of that, one in the beginning, that is after epidural injections and before electric impulses, he will take. So the thread, first he will talk about epidural injections. Then he will talk about that treatment modality, which you have to guess. You have to listen, not guess. You have to listen and so thread, he's follow the thread. So once you're done with epidural injections, next what he's going to tell, that you have to be ready for that one. Be ready for that thread. It is going to come. Then afterwards, electrical impulses hits. That means this thread has already gone, the previous one. So if you think about guess that answer, now it will not come. So it has already come and gone. So you have to be very careful, be very alert, be very focused. Okay. Then next one. Next, after electric impulses, he will tell, yeah, you go for this one. No, 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 I don't want. So what is that one he doesn't want? What is the treatment he does not want? He doesn't want to try what? Maybe some steroids or creams or some other medication or something like that. Okay. Then next one. Now patient attributes recovery. So he had four treatment modalities. And out of that one, the fourth one, he decided not to try. So these three treatment modalities are there. So it may be the first of the three, or the second of the three, or the third of the three, or the first two, or the second two, or the first and the last, or all the three. So combined. So it may be anything. So recovery may be related to one or two or all of them. Okay. Right. So it may be related to medication compliance also. Okay, compliance, his compliance with the medications and treatment, maybe compliant because he's of his compliance to suggestions. That also may be there. So be very careful what he's attributing. He's telling that this recovery is because of. So what is the reason for his recovery? What is the reason for his recovery? That's what you have to identify. Then sciatica probably related to. Okay. Next. So you are following the threads during the conversation. Now, smart strategies to use. Smart strategies to use. Now, try to understand these smart strategies. What are these smart strategies? Go through them first. I'm going to teach you a lot of things. Yeah. Smart strategies to use. Smart strategies to use. Yeah. So visualize, okay, the pattern, how it is going. The first, past injury, then current symptoms, then treatment, then referral, then improvement. You can see how it is going very clearly. So this is the chain of events, the sequence of events. It is not visible directly, but you have to visualize. You have to visualize. Otherwise, you will not understand. Okay, it's not easy. So if you know that this is the sequence, then you will be ready for everything. So first, this is called the story flow. The story flow. So first is starting with past injury, that also with past. That is 18 months ago, then 12 months ago, then 6 months ago, then what? But like that. They're coming in a system, organized way. Organized way. So in your speaking also, when you're doing a consultation in the role play, you learn a lot from listening. Okay, first part A. How do you have to learn speaking? You can learn from listening, part A. Right. So visualize the flow. Past injury in the beginning. There are stages. Second stage is current symptoms. Third stage is treatment modalities. Fourth one is referral. And then fifth one is improvement. Okay. Now let us see. Main mark key. Mark the key. Now here, lifting, sciatica, pain, numbness, injections, physiotherapy. These are some words which are very, very important. Lifting. Lifting what? You have to predict the answers. You have to mark the keywords. You have to underline the keywords. You have to underline the keywords. For example, you take the word lifting. Now, point number 3. After underlining the keywords, you have to guess like this one. Prediction. You have to guess. Lifting. Lifting dash. Okay. Lifting what? Lifting something. Lifting something will not injure your back. Lifting something will not trouble your back. You'll not get injuries if you lift something. If you lift something very heavy, then you'll get problems. So that means you are lifting something which is very heavy. Okay? Not lighter things. So you're lifting something heavy. So then you have got this injury. You have got this injury. 1 second, please. Hello? Yes. Yeah, sorry for the interruption. I had a call, so I had to attend. Yeah. So now here. So predict answers. Example, lifting, likely something heavy. Occupation, likely job name. Okay. So for example, when you say occupation, it may be salesman, sales supervisor, or salesman, or tourist guide, or something else like that. Okay. So a gap after as needs an adjective. After unable to. So for example, a gap after as, that means next to as. He appears as if he is clever, as beautiful as tall as, adjective, as means like, he's tall, like, okay, as tall as short as clever as big as beautiful as. So as demands an adjective, as demands an adjective. Okay. And then after unable to do something, né? Unable to play, unable to sing, unable to jump. So you have to be aware of some grammar like this one. If you are aware of this grammar, it will be very easy for you. So that's what it is. These are some strategies. You have to visualize the story. You have to make some, mark some words, underline some words. Underline, mark means underline or highlight. Underline some words which are very important. Lifting, like that. Okay. The next one, predict. Predict means guess, brainstorm. Okay. Then be grammar aware. So you have to be aware of grammar. Yeah. Next one, example. So we are seeing these three examples now, and we'll get some final tips here. What are the three examples? Only 1, 4, and 6 I'm giving. We'll go into depth later. So, example from test 1, sciatica. Lifting. Lifting what? Lifting what? Lifting something. Lifting an object. Lifting a metal instrument, maybe. Lifting a machine, maybe. Lifting a table, maybe. Lifting a carton, maybe. Lifting a heavy suitcase, maybe. Lifting a trunk, maybe. So, lifting a patient, maybe, if he's a nurse. Okay, lifting something or someone. But most likely here it is something, some object. So, it should be followed by a noun. Most likely it's a noun. So, lifting a bundle of books. Okay. So, what you're going to get, it's a noun. You have to realize that very clearly. And you should be, your target is a noun there. Next one, inability to. Inability to do what? He is not able to do something. What is he not able to do? To bend, to run, to sit, to jump, to stand, to sleep. So, here you need a verb. Inability to bend, inability to run, inability to sit, inability to jump. Like that, you'll guess these words here. You'll guess these words here. Then occupation. Occupation is, what is an occupation? You know, he is working as a person who travels to different places. That's what we saw. Occupation. Yeah, occupation. Here it is. Occupation dash involves travel and some manual work. So based on that one, he travels. When he is working, he travels. His work involves a work. His work involves a travel and some manual work, physical work. So maybe based on that one, you have to guess what's the role, what's the job title. He may be a salesman, tour guide, event organizer, courier, driver, or something like that. Tour guide. So you are taking one or two examples like this. We are taking three examples and we are analyzing. Now, final tips are stay calm. Don't panic. Stay calm and don't panic. Don't try to remember the answer now. Just get it ready to catch. You cannot remember the answer now because the audio did not start. How can you recall the answer? Don't remember anything. Just be ready to catch the word. That's all. Be ready. Now, this 30 seconds is your mental tuning fork. Tuning fork. It's tuning your mind. It is used to sharpen your focus. Okay? It is used to sharpen your focus. This is the basic idea about what we are doing here. Right. Now, let me know whether this explanation was useful for you or not. If you say it is useful, then I'll go ahead and explain all the 12 points so that these tricks you will use in the next session. Yeah, please write down whether it was beneficial or not. How much beneficial is it? 0 to 100%. You give your rating. 0 to 100%. How much beneficial is it? Just give your rating here so that I will know that it is useful for you. It is beneficial for you. Just give your number there, 0 or 25 or 50 or 75 or 100. How beneficial is this for you? Give your grading or rating to my explanation. If it is useful, extremely useful, highly useful, give 100. If it is nonsense, then just give 0. Yeah, please. I hope you are there, all of you. Just give one comment there. Yeah, Dinukshi. Then next, Dino, Saima. Just give your comments there. Okay. Next. So we are going to the next phase. Yeah, that's good. Thank you, Dino. And Saima, you also can give something. Right. Trainer script. Now we are going step by step. Step by step. Okay. In first 5 seconds, what we have to do. Yeah. All right, everyone. Your time starts. Your movement. You hear. Yeah. Okay. Right. Now here, all right, everyone, your timer starts the moment you hear. Now you have 30 seconds to look at the notes. The trainer will say there. Okay. So let's break down exactly what you should do in the first 5 seconds. Step 1, eyes on the instruction. So first 2 seconds, eyes on the instruction. Quickly shift your attention to the very top line on the page. That's where the instruction tells you who is speaking to whom. Who is speaking to whom? So you hear a physiotherapist talking to a new patient. So that's it. And the patient's name is Resans. Okay. This one sentence is gold. Why? Because it tells you the setting. It's a clinic, physiotherapist clinic. It tells you the roles. So one is the physiotherapist, medical professional, and the second one is the patient. And the type of language you are going to expect. So physiotherapist language is not a surgeon's language, it's a physiotherapist language. So remember that. Then second, step 2 to 4 seconds. 2 to 4 seconds. Now in your mind, imagine, create a picture. A physiotherapist, that means physical rehabilitation, muscle talk, exercise, pain description. So a patient, so expect complaints. A patient is there. So patient is talking about his complaints. He's telling, I have this problem, I have this problem, I have this problem. So he will tell you about the symptoms also. What symptoms is he experiencing? For example, pain is a symptom. Timelines. You hear the timelines. 1 year back, 2 years back, 3 years back, like the timelines. Maybe emotional expression. I feel sad. I feel very upset. I'm worried. I am in tension. I am not able. So all these things, his emotional expressions also. So he will be speaking. So be ready for those things. Next, step 3, 4 to 5 seconds. Ask yourself quickly, who will be giving medical facts, reality? The reality, who will give the facts? The physiotherapist. The patient will not give the facts, the truths. Patient will imagine, but the reality will be told by the physiotherapist. He is the authority over the subject. So, who will be describing personal experience? The patient. So, be ready what their roles are. Okay, he says this is this is because of this, he will tell. So who? Physiotherapist. Then this helps you to predict whose words will likely contain the answers for the blanks. Okay, right. These 5 seconds are about one thing: knowing the battlefield before the fight begins. If you don't know who is speaking and what the correct context is, you will be lost before the listening even starts. Now next 10 seconds, 5 to 15 seconds. Look at the bold or underlined headings. The bold and the underlined headings. What do you mean by the bold headings? Now, bold, you can see these are bold. Okay. Bold headings. And if there is any underlined headings, those also you have to check. Bold and underline. So those you have to see, like dates, stages, categories, timestamps. 18 months ago, last month, patient's description of symptoms, occupation, initial treatment. These are all bold. And they are your road signs. So go left, go right, go straight. That means they are telling you what is coming next. If you go left, where you will go. If you go right, where will you go? Next is the symptoms. Next is the referrals. Next is the treatment. Like that one, they will tell you what is going to come. They are signals, they are indicators, they are markers, okay, which tell you what is going to come. The headings are going to tell you what is going to come next for you. That's very, very important. So what do you learn from this? There's a timeline: past injury, recovery, relapse. See the timeline. 18 months back, there was an injury. Then afterwards, there was recovery. Then 6 months back, again relapse. Okay. 1 month back, relapse. 6 months back, everything clear, symptoms clear. So 18 months back, injury. 12 months back, problem, sciatica. Then 6 months back, recovered. Then after 5 more months, 1 month back, relapse. So how it is going? Try to understand this. Next one, glance through bullet points 7 to 13. Okay, glance through bullet points now. For example, let your eyes glide over the bullet points under each heading. Don't read it deeply, just observe the flow. So first one is telling pain, then mobility, then sleep, then NSAIDs, then referral, then injections. So these are the clues that tell you this consultation involves back pain, then functional limitations, because mobility, they're facing problems, sleep problems, then treatment, how the treatment was made using NSAIDs, referrals and all injections and all these things. These are the treatment attempts. So how it is going, it's developing. Now in your mind, so 13 to 15 seconds, you develop an order, logical order. Injury happened, pain developed, treatments attempted, symptoms returned, specialist referral, that work, what worked and what did not work. Okay. This is a narrative. He's explaining everything. So be ready and ready to expect what is going to come next in this order. Then purpose of the recap, you follow the journey, what he's telling, the patient is telling. So step by step, he'll be talking. Step by step, he'll be talking all these things. Step by steps. Okay, there were only 1 or 2 students. Now there are 6 now. That's very good. So there's these 10 seconds. These 10 seconds are for training your mind to follow the journey of the patient. We'll tell first this happened, then I did this, then I did this, then I went to a referral, the referral gave me this one. All these things he'll be giving in an order. So you're following the order like a detective tracing a case history. Okay, a case, a criminal history or a case history. You're a detective following a criminal history like that. You are a physiotherapist, you are a person, nurse, following this case history, what the patient is telling. Next, 15 to 25 seconds. What you will do? Go through this for a second. So if you feel that this session is very excellent, you invite your friends. Send this link to your friends. Yeah, it's a marathon session, okay? I'll be teaching you a lot of things, lots of things. Yeah, because if you understand this session, you can do any session. These are the basics which most of the people don't follow. Yeah. So now step-by-step guide for 15 to 25 seconds. Now you have got the context and timeline in your hand. You have the context and you have the timeline. Okay. So based on this context and timeline, right? Context means bullet points. Timeline means what happened, what happened next. That one. So already understood. So based on this, you'll fill in the answer gaps. You'll start thinking. Now start to blank number 1. Okay. And go down to about 6 if possible. So first let us see, do one thing together. Let's do number 1. We'll not do everything, we'll do some, not all. Okay. So start with the blank number 1 and go down about 6 if possible. Okay, now we are seeing number 1. So don't read everything. Don't read everything, no need. Read only those things which are very, very important. Just focus on the few words before and after the blank. 1 or 2 words before and 1 or 2 words after the blank. No need to read everything, because the words before and the words after will tell you what you are expecting there. Okay. Now here, let's do one together now. We are doing together now. Number 1. Back injury sustained. Okay, back injury sustained. What is there? Nothing. Okay, lifting. Back injury sustained, lifting. So lifting, connect these two sentences. Back injury sustains when he was lifting something. So lifting something. Playing football, playing something, eating something, drinking something. So lifting something. So lifting, what are the things that you lift? What are the things that you lift? Eating something. What are the things? What are the things? Something. What is that something? So what are the things that you eat? What are the things that you drink? So doing something. Doing what? Okay. So lifting something, playing something, eating something, drinking something. So lifting something or lifting some things. Singular or plural? Lifting some machines, lifting some tables, lifting some chairs, lifting some tables, lifting some cartons, lifting a heavy box, or lifting heavy boxes. It may be singular, it may be plural. So something, what is that thing? So what you are expecting here, you are expecting a noun. You are expecting a noun. So what may be the noun here? So noun may be a box, noun may be a suitcase, noun may be a trunk, noun may be a carton, lifting a carton or lifting some cartons, lifting a box or lifting some boxes, lifting a suitcase or lifting some suitcases, lifting some chairs or lifting a chair, lifting a table or lifting some tables. So you are getting a noun here. You're getting a noun here. So that's what is very important. One solid session is enough. Sandeep Kaur. Okay. One solid session is very, very important. Saima gave 100%. Thank you, Saima. Thank you very much. Okay. Aisha Chaturani, Dinushka, Saima, and Sandeep Kaur. Very good. All of you go through these points. Very serious points I'm telling you. Because many people, they want to do something, but they don't want to do the basic things. Okay. They don't want to do the basic things. So ask yourself, what fits here grammatically? A noun or a verb or an adjective? It needs a noun. Something he was lifting. What is that something? Likely answers are a box or some boxes. Weights, furniture, okay? Not furnitures, furniture, that's all. Furniture is a collective noun, right? Right. Next one, let us take number 4. Inability to dash. Inability to dash as most frustrating. Inability to, not able to, not able, unable, not able. For what? To do what? Not able to do what? He is not able to jump. He is not able to dance. He is not able to sing. He is not able to run. So here it must be a verb. It needs a verb. Okay. It needs a verb. So as is there. After as, there will be an adjective. Most frustrating is an adjective. Frustrating is an adjective. So after as, there will be an adjective, because sometimes as will come before the blank. So I'm remaining. So here, as is there. So after as, there will be an adjective, frustrating. Frustrating is an adjective. So whenever a verb as comes before a blank, so for example, I have told you earlier also. See, for example, as. So here you can see as is there before a blank. That means the next word is an adjective. So I'm helping you here. Okay. So as, after as, you will have an adjective. Remember that. So here, to is the inability to, not able to. Normally to is a preposition. But if preposition before there is a noun, after also noun will be there. But it is able is there. Enable, inability, not able to. not able to do something. So to is with enable. Okay, enable, able, ability is related to action. So verb will come. To infinitive. Infinitive will be first form. Infinitive will be first form, right? Right. Not able to run. So here it could be sit, bend, drive. Not sat, drove, or driven. Okay, not drove or driven or driving. It should be drive only, first form. Okay, first form. This is grammatical concern. This is grammatical concern. Remember the grammatical concern here. All right. Remember the grammatical concern here. Right. Next. Okay. You're not guessing the answer now. You're not guessing the answer, but you're making some mental answer shapes. So there is a verb. This verb will be V1 form. It may be any verb in the first form. It may be run, it may be jump, it may be sit, it may be drink, inability to drink. Okay. Inability to eat, maybe because of some problem in the throat. Okay. Pain in the throat, or itching in the throat, or irritation in the throat, or pain in the throat. Something may be there. So anything may be there. Eat, drink, sing, dance, get up, lie down, sleep, bend, run, jump, any word it may be there. So be careful. So you are not guessing the answer, but you are shaping the what will come there, what type of word will come. So you are zeroing in. Zeroing in. That means you are not going blindly into the battle. You are going with a weapon. You know what is there. You have a sword in your hand. You know enemy is coming. So you have to strike in his chest, or you have to strike the neck. Okay. You have to strike his neck, or you have to strike his heart. That's the point. Or you have to strike his forehead. So target is there. It's a verb. It's the first form and related to sciatica. Okay, fine. Next one. Almost you know what type of word is coming. Okay, right. Not just a verb. Which form of the verb also you know now. That's the first form. To infinitive, to play, to sing, to dance. Not past tense, not future tense. It's the present tense infinitive form. Next one. Now predict word forms. What are word forms? Now 20 to 23 seconds. Now that you have checked the few blanks, identify what types of words you are listening for. Is it a verb, or is it a noun, or is it an adjective, or a time reference? So four things we have here. There may be many other things also. So noun, verb, adjective, or a time reference. So now let us take example number 5. Dash sensation. Every time I'll take different example. Dash sensation. Dash sensation. So what type of sensation? Pricking sensation, irritating sensation, itching sensation, okay, tingling sensation, burning sensation, tight sensation. Sensation. It's a feeling, or it's a sensation. What do you feel? Mild sensation, moderate sensation, intense sensation. Okay. So what type of sensation it is? So be ready to listen to that sensation. What type of sensation? It is, it's like, burning. You feel like something is very tight, pricking with needles. It is an excruciating sensation, burning sensation, itching sensation, tingling sensation. Okay. What type of sensation? Now mark danger zones. Mark danger zones. What are the danger zones here? So these are final 2 seconds, 23 to 25. Danger zones. There will be some tricky situations. What do you mean by tricky situations here? Tricky situations. So for example, there will be unusual structure or sit in long sentences. quickly put a dot or underline to remind yourself to listen extra carefully during those moments. This final 2 seconds, spot any tricky ones if they confuse you. Okay. So the blanks that have unusual structure. So for example, just a blank is there. Nothing else is there. Or long sentence is there in the middle, there's a blank. So such one, you have to be very careful. That means he's going to talk many things about that. Okay. For example, let me show you here. Now question number 4. Now question number 4, you see, it is very long. And before that, there are 2 points. Okay. So here no answer, here no answer. But here there is a chance, the question and answer. Okay. And it is very long. Oh, I am facing some problem. I am not able to manage and I am not able to do these things. I'm not able to do these things. So he'll be explaining long version maybe. It's very unbearable, you know. What? What is that unbearable? It's troubling you very much. I'm not able to, I'm not, then comes that. I cannot. I'm not able to. It's very difficult for. Different forms will come. He will not say inability to or not able to. It's extremely difficult. It's impossible to. I cannot. So he can say any other form. So be very careful. This is very tricky. This is going to be very tricky. Very tricky. So you have to be very careful in this point. Next. Right. Next one. This phrase trains your brain to predict the shape of the answer. So because it was very long, you can understand, you can make a mental fitting. So he's going to talk a lot of things and 80%, that big sentence, 80 to 80, 90% will be waste. Only one word we want. Okay, only one word will unable to, that verb, move, jump, skip, bend, jump. What is that? 1 or 2 words or phrase that you have to catch. So you are predicting the answer in a long run. You don't need the content. Why? Because if you know you are waiting for a verb, you won't be distracted by hearing a noun. Now here you know that you need a verb. So you will not wait for a noun or an adjective. You know a verb comes here. So your guess, you are ready for the verb. And it is the first form of the verb. Okay. So you'll be ready for that one. What is that verb which is going to come? So you will not get distracted. There are 100 words he's going to speak, but you need 1, 2, or maximum 3 words. So you'll be ready for only those 3 words with a verb. So you'll focus more on verbs and you'll not focus on nouns. You'll not focus on adjectives. That's the point. Okay. So for example, you are in the house and you are doing some work, some homework or some housework. Then suppose your people are talking in the family, your son is talking to father or mother or brother or sister. So they are talking and suddenly you'll be hearing them. You'll be hearing them. You'll be hearing them. Then it's going into your head what they are talking, everything. But you're not very 100% attentive. Suddenly it's a mummy. Then immediately you'll turn. So that means you are listening to them now. So when something important is coming, you are fully attention. Earlier, you are doing your work. Earlier, you are doing your work. And it's going into your head because you have ears. They are speaking. They are sitting in the hall and you are in the kitchen. Hall, one door between, that's all. And you are able to listen to them. You are able to hear them. That means everything is going inside. Now, when he says, mummy, immediately you turn your head and say, what? Why this difference? Because till now, you are hearing and now you started listening. That means all the unimportant things will go into your ears, but they will be neglected. That is called hearing stage. And once the most important thing which you want to listen, automatically your brain will be ready for that one and catch immediately. He did not tell you, I am going to tell mummy. But suddenly he said, mummy. But you are alerted. Why? Because you know what you want. You know how they call. You know what you are expecting. When they say, "Mummy," immediately respond because your mind is already tuned because you know, but your son only calls you mummy. So when he says mummy, you'll be ready, 100%. Body, mind, and soul, everything ready there. So this is the difference between hearing and listening. You hear everything, but you listen to only what the target words are. See, they were speaking for almost half an hour. In between, one time he said, "Mummy," you attended immediately, and afterwards you responded to him and you answered to him. Then again you fell into your work. That 1 minute, 10 seconds or 20 seconds, you attended him, and afterwards you're back to work. Again you are hearing, but not listening. You are hearing, but you're not listening. Remember that. You are hearing, but you are not listening anymore. That's the point here. That's the point here. You have to, that's the difference between hearing and listening. Okay, that's very, very important. Yeah, this girl is Saima is very interested. I think she's attending from the beginning to the end. Very good, Saima. I appreciate your patience. I can understand that you are very serious. Thank you. Yeah, let me switch on the lights because it became dark. It's raining heavily outside, and it's became dim. So I have to switch on the lights for the room. Yeah. Next one. Okay. So thank you, sir. I'm first time taking your class. It's very interesting. You are the person full of knowledge. God bless you. Thank you very much for your blessings. Okay. You can message me personally so that I'll put in your regular group. Okay. You have my WhatsApp number, I think. So you can just send me a message in the WhatsApp and I'll put you in our regular group where you'll get the links. Okay. Right. Um, So this phase trains your brain to predict and shape the answer. Mentally, you are getting ready. Mentally, you are getting ready. Yeah. Yeah, you have my number, I think. So it is 98. I'll give you. You have my link. So you can take my link and you can, the message where you joined my WhatsApp, I only put the link. So you can send it to me personally there. Okay. Uh, or in the same group, you can just message me, sir, I am like that. Right. So you know you're waiting for the verb. You won't be distracted by hearing a noun. Okay. You'll not waste your time and energy. Okay. In listening to everything. You listen to only the important things. It sharpens your mental filter. So when the right word comes, your catch is instantly. When the right word comes, your catch, okay, is perfect. On the spot, you'll catch the word because you know what you are expecting. For example, this listening test is a supermarket. You go into a supermarket, you don't know what to buy. You will get lost everything. What the things are important, you won't buy. What the things are unimportant, you will buy. You'll spend all your money. You'll waste all your time. You'll go here, there, looking at. It's a meaningless waste of time. But if you know what you want to buy, you had already made a list. Okay, I need these 20 items. I'm going to the supermarket. So list is already there. What you will do? You'll go and buy those things, put in the bag, and the family goes to the cafeteria or meals section. They'll have their lunch, then they'll go to the movie and they'll spend lovely time. Otherwise, what happens? what happens? You'll spend waste of time, waste all the time in the supermarket. You don't know what to buy because you're not mentally ready. You'll waste your time. You lose everything. You'll finish your money. Now you don't have peace of mind for the full month because money is finished. So this is the way how you have to be very careful. You should make a list of what you. So we are going into the supermarket with a list of things. We need a verb. We need a noun. We need a common noun. We need a plural noun. So we need this. We need this adjective. We know we are expecting a feeling like that. We already have a list of what we want from the audio. Audio is the supermarket. Audio is the supermarket, and we already made a list because in these 30 seconds we have planned everything and we know what we want. Next, 25 to 30 seconds. Last set, 5 seconds. Last 5 seconds. 25 to 30 seconds. All right, team. We are in the final 5 seconds before the audio begins. These seconds are not about reading anymore. They are about linking your brain to the patterns on the page. It's time to highlight themes, repetitions, and emotional threads. So highlight themes. What are the themes? What are the repetitions? For example, pain, pain, pain. Treatment modality, treatment. 4 are there. The 4th one is neglected, but we want what he doesn't want. So what are the themes? How the steps are going? What is the sequence? What is the thread? Emotional thread. Okay. So next, look for repeated vocabulary of themes. So now let us see. Quickly scan and notice repeating words or closely related terms in this particular thing. See, for example, you will see pain, pain, numbness, sensation, injections, referral, treatment. These are the sequence of things. Okay. These tell you the speaker will repeat certain core topics. They are fundamental, they are basic, and answers will cluster around them. Answers will be mainly about this one because he's talking about pain, he's talking about treatment, he's talking about sensation, he's talking about reference. So answers will be there together in clusters. For example, he's explaining his symptoms. One by one, all the symptoms will be told. So then you have to notice what are the symptoms there. Okay, you have to notice what are the symptoms there. Now, these tell you about the speaker will repeat certain core topics. Core topics means foundational, basic, fundamental topics. And answers will be clustered around them. These points only, mainly. For example, so if you hear the word pain coming again and again, so you should mind a signal. It's a signal. Be ready, be ready, be ready. I have some pain, I have some pain, I have some. So what type of pain? He will tell next. Where is the pain? He will tell next. For how long is the pain? He will tell next. So he will tell about pain, everything about the pain. So one by one, the clusters will format there. Now let us see. Be sharp there. For example, let us see here. Think like this. Okay. First, they'll talk about how it all started. Started with injuries. Then move to current symptoms, complaints. That's symptoms. What he does for work, then what treatment was given, what helped or failed. So you can see the order sequence. Okay. So complaints or symptoms, they are all in one place. Treatment, all in one place. Okay. So everything, they will be in that one particular place. So thus in the narrative thread, for example, get ready to follow it like a story, how it started in the beginning. So he'll tell you the history, past history. Then his current, past over, now present. Current symptoms. Then he'll go for work. Then he'll go for treatment. Then what treatment helped. Okay. So all these things. So mentally prepare your focus for this order. Follow the speaker. You have to follow. You don't expect whatever you want. You have to follow the speaker, what he's going to, you have to guess the way how he's speaking based on the clues. Now, last second, breathe in, eyes steady. Now your job is follow the speaker. Finished everything. Listening for transition phases like, then I tried. Transition. First I did this, next I did this, from one to another. First I did this, it was not successful, so I did this. So transition mode. What really helped was, so these are, that means others really did not help. what really helped was this one, this one, this one. I don't think this one helped this one. Maybe all of them, or the first two things, this medication and this physiotherapy, both helped together. So all together, what really helped was, so he has taken 4 types of treatments, 3 types of treatments, and 1 he rejected. So what really helped of these 3 treatments? So he'll tell finally. So that is a transition. Okay, right. See here, the transition. I'll show you now here. So first one, these are the treatments 1, 2, 3, and 4. So patient attributes recovery too. So after all the treatment modalities which were discussed, then he will say, finally, what really helped me, what to recover was, finally, okay, finally, recovery was at the end, or in the end, the recovery was because of certain, so 1, 2, or 3, or 1 only, mainly to electric impulses, or mainly to epidural injection, or mainly to point number 9, or all the 3 together, 8, 9, and epidural injections, 9, and electric, all of them together. So it may be joint effort of everything together, collective effort maybe. Okay, so collaborative effort maybe, collaborate to everything. Okay, all together. So like that. Next one. So be ready to write the exact words you hear. Don't give synonyms. Don't give substitute words. Don't modify. Write exactly what the words you hear. That's it. What are the words you hear? Those only you have to write. Those only you have to write. So this is not a test of memory. It's a test of real-time precision listening. Precision means precise, accurate, real-time, exactly when it comes, that time only. Real-time precision learning. Now let me tell you one thing. This is, for example, a pen. This is a pen. If I catch it exactly, you see here, there, exactly, perfect second, it will be in my hand. 1 second before, if I catch, 1 second before, 1 second before, if I catch, the pen will hit on the top of the hand and it will fall down. 1 second after, it already slipped through my hand. So exactly that particular 1 second, 1 second, exactly, then only you can catch. That is called real-time precision listening. The word will come on the spot, you have to catch. So this is no need of any memory on the time. You don't know the word, no? How do you want memory? You don't need to remember anything here. On the time you catch and immediately write your answer. So Simon's left hand rule, I already taught. Okay. You put your thumb on the question mark, put your pencil on the answer place, pointing finger, thumb on the question number. So for example, the question number is 7. Put the thumb on the 7 so that your focus will be there. Put the pencil, sharp pencil point, pointing finger. So thumb, pointing finger, okay, pointing finger. Put this pointing finger, okay, on the paper point, on the paper there. Put the pointing finger on the paper point. So where you write the answer, this is the question number, this is the answer number. So blank where you write the answer. Put the pencil exactly on the place where you write. Number 2. Then third one is middle finger. Middle finger will point to it's outside, totally outside. See, 3 fingers. So first finger, second finger, third finger. If you close, this is totally outside. So this comes outside. So take your ears, which are outside. Okay, a lot of experience of 40 years experience. I'm teaching you all these things. So these are ears which are coming out. Okay, these are ears which are coming out. So this is audio. Audio is coming out from somewhere, and your ears should be ready for the audio. So your ears, third one, your ears should be ready for the audio. So this is the question number, and this is the answer area, and this is the audio script. And the fourth one is going little inside, half inside and half outside. That is your eyesight. So this is your audio capacity to listen. So ears, ears. So third one is your ears, thumb. Middle finger is your ears. So ears, you have to focus on the audio. You have to focus on the audio. Right? Till now, no audio. So you did not focus. But now you have to focus on the audio because audio is going to start. Okay, you have to be very clear, ready. Your ears are full. You have to be all ears, full body ears, like that. You have to be full attentive, 100% attentive. So ears should be open and ready to the audio. That's it. Audio ready. The next one, the fourth finger. The fourth finger is going half outside and half inside. See, this is not outside. This is inside, little inside, and but more outside. So that means I. So I, you can see out from outside, but it is inside more. I hope you understand what it is. So the fourth one is the vision. Okay, this is the audio and this is the vision. Vision means what you see in front. Here, what you hear from the audio, but here, the fourth one, this is a ring finger, we call it, a ring finger. So ring finger relates the eye. So this eye should focus. This eye should focus from the question to the answer, from the beginning to the ending, that entire rectangular area. For example, question number 3 is here. This is 3. Your thumb is here. This green thumb should be here. And your answer blank is here, suppose. In this brackets, blank is there. So your pencil should be here. So from the question to the answer, you should be ready. Full rectangle from this corner to this corner. You have to be ready. So here to here, you have to be ready. So for example, you are attempting question number 3. So your pen thumb will be here. And answer is here in the brackets, blank. So your pencil will be here. Question will be, thumb will be here in the first place. Question number, step number 3 there. And your pencil will be 29 to 30 seconds. Answer you are going to write now, 29 to 30 seconds. There is a blank actually. Okay, there's a blank actually. There is no 29 to 30 seconds. That is the blank. So there your pencil will be ready. And now your ears are towards the audio. Your eyes need not look at the audio. Only your ears should be, okay, towards the audio. That means ready already. No problem. Even if you turn this side or this side, your audio will go into your head only. No problem. Because audio is already meant, sound is meant to go from any side of the room into your ear, from wherever, from back, front, left, right, top, bottom, anywhere you speak, the audio will definitely go into your. The system is created like that by the great Almighty God. So no need to worry about the audio, because you need not twist or turn your head up or down, left or right, front or back. No need, because audio will automatically go. The next one. So no need to bother about that. Only your ears are ready for the audio. The next fourth one is the eye, vision. Vision should be only in this rectangle at that particular point. For example, first question is coming. Your vision is in this area only. Don't go, because this is hands-on practice. This is hands-on practice. Question to question to question to question. 1, 2, 3, 4. 1 finish, then you will go to 2. 2 finish, then you will go. So this is hands-on practice. 1 finish, then you go to 2. 2 finish, then you go to 3. Otherwise, don't go. If you did not get the answer, that means the question is already gone. So then move to 2. That's it. So hands-on practice. So fourth one is the vision. This vision in this rectangular area where the words or the blanks or the question number, from the question number in the beginning to the ending, wherever that sentence is there, from that corner to this corner. For example, let me show you here. Yeah, let me show you here. So for example, this is the question number 10. So you have to be ready from here to here. Your focus will be from here. Electric impulses, finished. Now next is decided not to try. Electric impulses, you already heard. You did not listen because you don't want. But it already went into your ears. You know that electrical impulses, even if you don't want also, it will go into your ears. And you caught it already. But you don't need to write. So you don't focus much. Then immediately, electric, immediately you are ready. Next answer is coming. Decided not to. So immediately your hand is on question number 10, that bullet point. There your pencil, your question, your thumb is here. Your thumb will be here. and your pencil will be here, starting where you will write. So your vision will be from here to here. This is your vision. So thumb, pencil, and your vision. Three things are there. So one is the thumb, two is the pencil point, where you write the answer blank, and number four is your eye, that is the vision, that corner to this corner, from question thumb to answer pencil, everywhere, that corner full, your focus will be there, okay, until you get this answer. Then you will go to the next one. Okay, so be ready, be ready. And now the third one is the ear. That's already we discussed audio. So question, answer, audio, and vision. That means script, which that particular moment, only that one you have to focus. Okay, because the audio is speaking about this one now, then only you have to focus. Don't focus on everything else. Your focus should be limited to that particular question only. Don't bother about what the answer you lost earlier. Don't bother about what the answer that is going to come later. Focus only on that particular question which you are focusing and which is on the audio playing right now. That is called real-time precision learning. Real-time precision learning. Real time, that second, that particular second, when the answer is coming, that time only you can listen. 1 second before, you cannot listen that word. 1 second later, you cannot. Exactly that second only you can listen. That is called real time precision learning. You can do this only when you are ready for that one. Mentally ready. If you can make use of these 30 seconds properly, there are goosebumps all over my body. I don't know whether you got it or not. I have goosebumps all my body. That means I'm highly involved into the lecture. I'm highly electrified in the lecture. And my full spirits are there in the lecture. That's it. So you also should be fully 100% dedicated to, like how I am dedicated to teaching, you also should be dedicated to learning. Your goal is to pass the OET, not to learn the skills. Learn the skills, automatically you will pass the OET. If you want to pass the OET, you will not learn the skills. Remember that. So learn the skills to pass the OET. Okay. To pass the OET, you will not get skills. You have to learn them. So learning first, then passing next. Okay. Don't think about passing OET without learning skills. So real-time precision listening is this one. And the last one is the little Johnny. Little Johnny. We call little finger. Little Johnny. So the little Johnny is there. Okay. Little Johnny. It's okay. Now this little Johnny is the last one. This is totally inside. See here. This is totally inside. It is totally inside. That means it has gone inside. It's totally inside. That is in your head. That is in your brain. So the brain. Now this brain controls all these four things. This brain controls all these four things. It will understand the question. Number one. It will understand the question. This brain will understand the question. Number one. The relationship between brain and the question. Yeah. So this is that somebody or something I'm not able to see. Okay. All right. Is there anything personal? Sir, can we practicing by playing listening video right now or not? No, wait. I'm teaching the basics, my dear. No problem. Okay. All right. So that it is your job, you can do anytime, no problem. But here that is different. I'm teaching you how you have to attend. If you can follow this one, that is very easy for you. No need to worry. I will play it for you. Don't worry. So I'll play you the audio and play you everything. Don't worry. So here, last one, brain. These final 5 seconds are about brain. I did not tell about brain, right? Yeah, brain. This brain is going to connect with your question. It is going to analyze your question. What is the problem? What is it expecting? What it's wanting? What it is demand? What it is. So this question is coming from the question paper. So question paper and question. So brain is analyzed question from the question paper. Right. Number two, the answer from the audio. Answer is not in the question paper. Answer is coming from the audio, but clues are there on the question paper. Clues are there in the question paper. So answer is there coming from the audio. So audio and this question paper, both are interrelated. Clues are there in the question paper. So these clues, you can guess what might be the answer. Many options will be there. 100 options may be there. But you know what exactly, what type of word, what type of form it is there. Everything you'll know that. So this brain is connecting the question, number one, that is with the thumb. This brain. See, these cannot connect. This connected. Thumb will connect with every other. So brain and thumb. Brain and thumb. So question with the brain. Question goes to the brain and analyzes. Next one, answer. You hear the answer and the brain, it is taking through the ears and it is relating to the question. So question, answer and brain, they are working together. Three things. Okay. Three things working together. And then the text. Okay. The text is here and the audio, all. Okay. The audio and the text, all the things together gives you a full picture 100%, and you can get the answer very easily. So these final 5 seconds are about setting your radar to the right frequency. Little difference, the picture will be not good. Earlier when I was a child, I know the radar will be there, that when you have to turn the antenna, TV antenna to the radar. If it is different, okay, if you don't turn it properly, then it will not catch. Okay. Yeah, it will not catch the signals. That's the problem. So all these together will give you a clear picture. If you have done your prep right, now you won't just hear, you'll catch without fail. And remember, sometimes hearing is passive, catching is active. I told you already, hearing is passive, catching is active. Catching means listening. Hearing is passive. Everything will go into your ears. That is, unintentionally it will go. You don't need any effort to hear. You don't need any effort to hear. If the sound comes, you will hear. But for listening, you need an attempt from your side. I have to listen. So you'll give full attention, concentration, and focus. Like, you know, you're in a bus. There are normally 50 people can sit, suppose. But there are 80 people, 90 people, 100 people together on the bus, fully loaded. Bus is fully loaded, especially in cities in India. Fully loaded bus. Now, everyone is talking. Something or the other. Okay. Some people are watching TV, phone, or something, making a lot of noise in the bus. Not silent. Bus is not silent. Everyone is talking. Okay. A typical bus. It's a typical bus where everyone is talking. Now, you can listen to everyone. You cannot stop it. Until you plug your ears, you can listen everything. If you don't want to listen, then you have to keep something in your ears. Otherwise, you'll listen, you'll hear. You will hear. Hearing happens automatically. That is passive. It's not active. You are not hearing. You are not hearing. It's automatically happening. If you don't want to hear also, it is going inside. Somebody is talking here, somebody is talking. Everything is going inside. But there is a friend of yours, your bosom friend. That friend is also talking to you. Now what happens? You hear every sound, but you listen carefully only to your friend's sentences. Why? You are giving extra focus, extra concentration, and extra attention, not to miss anything. That is what is called listening. Because you are trying to catch. You're not just hearing, you're trying to catch every word of it. That is listening. You're listening everything, but whatever you are trying to catch, because you are expecting something that you are trying to catch. So listening happens when you know what you are going to catch. That is called listening. Hearing, anything will go into your ears is listening. But what you intentionally do catch, that is called listening. So listening needs focus, listening needs concentration, listening needs attention. And most of their intent is needed. I want not to miss anything. Not I want to listen, but I don't want to miss anything. Everything I should listen. That's the point. So there are hundreds of sounds, but this voice only you can listen. Others you neglect. That's the brain has capacity to neglect. Noise eradication technique. We see in Samsung buds, noise reduction. Okay. Noise will not reduce in our ears, but what happens? Noise will be neglected. And what you want to listen, that only you will catch. That is what is catching is active. So listening is active, hearing is passive. Hearing you do unintentionally and you don't even bother about that. You take it lightly. But listening is catching. You are intentionally doing it. You wantedly doing it. 100% of your body, mind, and spirit wants to know. 100% of it, not to miss anything. Even 1% you don't want to miss. That is what it is. So you are listening for the 12 answers and you are going to catch those answers because you are mentally prepared. Yeah. Next. So how did you enjoy the session? Was it beneficial for you? Enjoying the session? Yeah. Enjoying the session. We are not done yet. I told you. Enjoying the session. Give your feedback. How is the session helping you? Karimi? Gayani? Sandeep? Yes. Right, fine. Just give your feedback, please. Who is this? Saima, I want to be your regular student. Yeah. Thank you very much. If you want to be regular student, you can be regular student. No worry. So, Sandeep is our regular student. Sandeep, do you want to tell about our classes to our new student? She wants to join just like you. Sandeep Kaur. Can I unlock? Unmute? Sandeep Kaur. Yeah, just to tell how we take personal classes and how I give personal attention. Are you there? Yeah, you can unmute Sandeep. Dinukshi is also our regular student. So Sandeep, you're not able to unmute. Huh? Why? Are you busy? Hmm? Very helpful and very good explaining. Okay, very good. Thank you. So Dinukshi, can you unmute? Dinukshi, can you unmute and tell about our classes, how they are going, and how I give classes like this, personal classes and special classes? Can you explain so that Saima can understand how our classes are conducted? Sandeep and Dinu. Oh, they are shy, I think. What's happening? Dinukshi, you're busy? You're at work or something? What about you, Sandeep? Okay, fine. Okay, Saima, I'll give you my number. You can just message me. Have you messaged me already? Yeah, Saima. I'll give you my WhatsApp link. Yeah. So, contact method, copy link. Yeah. This is my WhatsApp link. You can just message me. Hello, sir. I want to join your regular classes. And just message me on my WhatsApp so that I can follow it up with you. No problem. Welcome. I select like this only. Those who are really serious, then only I select my students. Otherwise, I don't select. Okay. So I have seen you. You are very serious. From the beginning to the end, you are attending. So that's why. Yeah, I'll accept you. No problem. But you can send me a message on WhatsApp. I have given you the link. You can message me on the WhatsApp there. Yeah. Next. What happened, Dino? You're not able to unmute. You're busy. Yeah, you deserve. You are very serious student, Simon. No problem. I can notice, na? You're very serious. You are very interested. Not even 1 minute you went out. You are attending from the beginning to the ending. No problem. You're good. Sandeep, are you busy? At least message me, na? If you are busy, so that I'll not call you repeatedly, right? Okay. Hi, Simon. Here. Good. I got your message. I want to be your regular student. Yeah, regular student. I will see till the end of the session. We are really there, and then we'll see. We'll finalize. I'll give you. Definitely, I'll give you. I already considered. You are from Saudi Arabia or Kuwait, or where are you from? Yes, Sandeep is busy, it seems. Okay. So 965 is from where? Kuwait or Abu Dhabi or United Emirates? Where? Exactly. Okay, fine. Kuwait, yeah. From Kuwait, there is one girl. This Dinukshi is from Kuwait. Who? Simon. This Dinukshi is from Kuwait. Hello, Dinukshi, are you from Kuwait? Yeah, Dinukshi is also from Kuwait. Dinukshi, are you busy? Are you at work? Yeah, I'll give you her number. You can talk to her. This is Dinukshi has joined our classes, regular classes. Yeah. Afterwards, can I give you a number to Saima Dinukshi? You are my favorite student. That's why I'm giving. Okay. If not favorite student, I will not give you. Okay. Dinukshi's number I will give you. Shall I give you? Without your permission, I am giving. Okay. You are my child. You know, I have the right to give, right? Yeah, sure. Yes, sir. Dinukshi is telling, see, she is my darling student. You don't know. So I'm sending the contact number, and I will send your contact number also to her so that you can get in touch. Okay. Anytime I'm available. So what is this contact? Contact of Dinukshi. Dinukshi Liyanage. Dinukshi, very sweet girl. Huh? Dinukshi Liyanage is very sweet girl. Small child like that she is. You will like her very much. Yeah. She is also from Kuwait only. See? Huh? Yes. In the I saved her name. Kuwait city. She is from Colombo. I saved her name. Dinukshi Liyanage. So intensive course. Kuwaiti city. Colombo. She's from Sri Lanka. Where are you from? Where are you from? What's the name? Saima. Where are you from? Are you also from Sri Lanka? Who knows? Maybe. Or some other place. Yeah. Even after 30 minutes, I have to go for mock test regarding any part B and C. Okay. Okay, dear. No problem. Yeah, Karachi, Pakistan. Okay, Saima from Karachi. I have many students from Karachi, Pakistan. Okay. Many students I have from Karachi, Pakistan, who are already there in UK now. They have passed and they are cleared and they are in the UK. Right. Very good. So yeah, I'll send your number also. You can send a message to her, Sam. So I can check this one. Or I can save your number and send it to her. Here it is. Yeah, copy number and send it to the Dinukshi. So you can discuss with her. And about Simon sir, how serious is Simon sir? She will tell you. And afterwards, if you want to join Simon sir class, then only join. Okay. If Dinukshi gives positive review about me, sir is very good, sir teaches very nicely. Almost you have seen, but still, after that you can take her review because she's already in Kuwait. Huh? You can talk to her. Then you can think about that. Yeah. So now we are going to the next part, Dinukshi, Saima, and Sandeep. We are going to question number 1. One by one, we'll go to the questions now. So perfect. Extracted question number 1, context. Line 1. 18 months ago, back injury sustained while lifting something. So now let's stream brainstorming blueprint question number 1. How to brainstorm any question. So question number 1. Let's streamline our thought processing using this master guide. So what part of speech is needed here? Lifting dash. Lifting, what is after? Lifting something. Okay. So structure, verb plus a gerund or participle or noun. Gerund, verb, gerund, lifting, doing something. So noun. So verb is already there. Lifting is a verb, which may be gerund or which may be participle. So next comes a noun. So the blank requires a noun. Something that was lifted. What did he lift? What did he lift? For example, proper noun. Is it a proper noun lifted Mr. Raymond? Unlikely. Okay. Unlikely. Chances are there, but not very likely, not 90%. Abstract noun lifted pain? No. Doesn't fit context. Common noun, yes. Box, crate, equipment. It may be anything like that. Okay. It may be anything like that. So next one, material now, metal, furniture, maybe table, metal table like that, table made of metal, okay, made of wooden table, okay, wood logs, bundles like that, material, okay. Next one, collective noun, supplies, okay, groceries, supplies, cloth bundles, like that, anything may be there, okay. So you have to be ready for that. Next, conclusion. Concrete, common noun, and material noun. They typically work or hope. So next one, grammar clue. There is no a, there is no and before the blank. But lifting is there. So next, lifting some heavy things, boxes, weights, etc. Next, check for the verb agreement. Injury sustained, past perfect passive, while he was doing something. Okay. So, plural, boxes, weights are uncountable. Could be plural also. Boxes could be uncountable. Furniture also. Singular maybe, plural maybe. If it is singular, A will be there. Okay. Lifting a heavy box. If A is already given, it is singular. Some is already given, it is plural. I'm guiding you. I'm helping you out here. Okay. I'm not wasting your time. I'm helping you out. If A is already given, it is singular. If some is given, it is plural. But here A is not given, some is not given. That means it may be singular or plural. Lifting a box or lifting some boxes, anything is possible here because nothing is given. Nah? So it may be singular, it may be plural. So be ready for both. That's what I mean here. Okay. So if you analyze the question, then only you can understand, right? Now, what kinds of objects are usually lifted? Okay. The speaking is talking to a physiotherapist and the patient is reporting back injury. So because of injury happened. Injury means some heavy thing. So weights, furniture, household, boxes, equipment, or patient if he's a caregiver or a nurse or something like that. Okay. This is in gym or rehabilitation setting, this household, this is office work, manual labor, equipment, professional work. Okay. Patient. Okay, fine. Now it may be manual labor or occupationally lifted. It may be Office, mostly. So, at workplace. So, emotional intensity speaker cues. What is it telling? A heavy or bulky item is more likely to be remembered. If it is a small thing, he will not remember, right? It's a very heavy thing, then only he can remember. That's what the reason for an injury. Expect something practical and relatable, not like a train compartment or a bus or a tractor or a car. No, he'll not lift a car or a train or something like that. Okay. So, practical and relatable. Then predict answer pool. Create some answer pool. Pool means some group of words which may be answered. So, lifting a patient or lifting some patients, lifting a box or lifting boxes, lifting furniture. Furniture means uncountable noun, so no plural. Furniture means all the things in the house are house furniture. All the things in the office are office furniture. So furniture is a collection of things. So all together. So next, gym weights, heavy equipment. Equipment also collective. Okay. You cannot say equipments. One equipment, two equipments, three equipments, nothing like that. One furniture, two furniture, three furniture. This is a collective noun. Furniture is a collection of things. Equipment is a collection of things. Okay. For example, scanning equipment means all the material related to scanning. From bed to the machinery. Everything is scanning equipment. You understand? Everything together. Okay. So toolkit, a toolkit or some toolkits. Machinery is also collective noun. A machinery, two machineries, three machineries, no. Machinery. So a ladder or some ladders, a suitcase or some suitcases, a child or some children. So it may be singular or plural. Remember that. Then analysis. Part of speech is a noun. Analysis, type common noun or material noun. Likely, plural or uncountable, or maybe singular also. Right? Manual work. Okay. Manual work. Lifting and injury. Right? He's doing some manual work. Lifting, so that's why injury. These are the words. He's lifting something and it is injury. So they included manual work. So next one, productive pool, boxes, furniture, equipment, weights, like that. Think of anything else. Now forget about that. Finished. You are ready for that. Mentally ready when the audio starts. So like this, pain located in. Pain will be located in the room or in the house or in the body. So where? In the body. So which part of the body? So it's a body part. Pain located in the stomach, in the chest, in the back, in the shoulders, in the right shoulder, in the left shoulder. Body part. The is compulsory. Whenever there is a body part, you have to write the. So A will not come here. Body part means compulsory the. Compulsory the. Cannot write A. A right shoulder. What is A right shoulder? What nonsense you are talking? What nonsense you are talking? A right shoulder? How many right shoulders are there? To say A right shoulder. It's the right shoulder, the one and only right shoulder. Definite. So here you are learning grammar. Pain located in the right shoulder, the left ankle, the right knee, the left wrist. So like this. One particular one, left or right. The right eye or the left eye, the right eye, the left eye, or both the eyes, the eyes. The is must. For body part, the is must. Because it is specific. It's not generic. It's not any. It's one particular. Pain in an eye. Which eye? It's not clear. Your information is not clear. Pain located in an eye. That's correct only. Pain is located in one eye. That's correct only. But which eye? You're not clear in giving the message. So the is perfect. That particular eye. Which is that particular? There is pain in one eye. Which eye? Left or right? Be clear. Be specific. Should I imagine that it is in the right eye or in the left eye? How can I? You are experiencing the pain and you have to tell which eye specifically. You have to be clear. So he is going to tell it very clearly. Particular one. So it is a specific body part and it's a specific body part, not generic body part. Okay? Be very careful. Okay? Be very careful. There is a must here. Pain located in the chest or the right side of the chest. The left side. Okay? The posterior side. The and upper side or lower side, the left side or right side, the front side or back side. So it should be very clear that particular side, that particular location, that particular place. Yeah. Now this is my left hand. So the left wrist. Left wrist. So particular body part. The shoulders means both the shoulders. The shoulders means plural. The shoulders. But when you are saying singular, it should be the right or the left shoulder. If you are saying one, be very specific. Otherwise, your answer will be wrong. Undeniably, it will be wrong. Be very careful. So now you know. If it is one, you have to listen for right or left also. Okay. Shoulders, it's okay. It may be singular, it may be plural. You are ready for but both. If he does not say right, if he does not say left, that means it's plural. Because the shoulder. How can you say the shoulder? That means he has only one shoulder. Mr. Simon Peter, that means Simon Peter is an idiot. He doesn't have common sense. How can it be the right shoulder? The shoulder? How can it be the shoulder? That means Simon has only one shoulder, right shoulder? One shoulder? And which is that shoulder? Is it right or left? That also we don't know. So you're getting confusion. So clarity is the name of the game. You should be very clear for body parts. So pain located in the forehead, in the left side of the forehead, in the right side of the forehead, between the eyebrows. Between the eyebrows. This is the forehead. This is the eyebrows. Okay. Left nostril, right nostril, nose. There is somebody who told me left nose, right nose. My God. 2 noses you have? Huh? I was doubtful. How many noses you have? No, sir, this is my left nose, no? Oh. The left nostril. The left nostril. I have some irritation in the left nostril. If you don't tell, the doctor will put something in his right nostril and, no, sir, not that one. So why did you not say beginning only? How do I imagine? You have to be very clear and specific. That's what it is. Definite article, the is a must. So pain located in is a preposition in. Pain is a noun. In is a preposition. Next one also will be a noun. Pain in hands. The hands. Pain in the hands. Hands also noun. Pain also noun. Noun plus noun in between preposition. Pen on table. Pencil in pocket. Pencil in pocket. Both the nouns. In between a preposition. A preposition is used to relate the relationship of 2 nouns. Pain in the head. So headache. Okay. Right. Pain in the head. Is that clear? That's very clear. So the blank requires a noun, specifically a location noun, location, exact location. Okay, you have to tell very clearly. Let's evaluate the possibilities. Proper noun. Okay, proper noun. New York. No, pain is in New York. Or pain is in Simon Peter. Proper location of Simon Peter. So abstract noun. Already it is pain. Okay, it's a discomfort. So common noun, yes. Where? Leg. Pain in the right leg or pain in the legs. Pain in the right hip or pain in the hips or tissue maybe. Pain in the tissue. Collective noun, both together. Lower limbs. Pain in the lower limbs. Pain in the upper limbs means hands. Together. The hands, the legs. Collective noun, limbs. Upper limbs, lower limbs. So indicating a body part. Pain located, no article used. For example, a and the. Here nothing is used. Okay. So preposition in is neutral. Accepts both singular and plural. Okay. It may be singular and plural. Okay. It may be singular and plural. Common with body areas in the leg. Common. In the legs. In the leg. Which leg? The left leg, the right leg. That's important. Which one? Left or right? Left or right? Left or right leg? In the legs, in the lower back, in the hip. Which hip, left or right? The hip region. Okay. So that also you have to think. In the buttocks, plural. In the left buttock, in the right buttock, or in the buttocks, like that. So it may be singular or plural. A known body part, region. So contextual field, lower back, buttocks, thigh, calf, leg. General term, leg. General term, the right leg, the left leg. That is specific, not generic. Okay, leg is generic term, the use it. In the left leg, the right leg, that is specific. Okay. Cross reference. Reports no history of pain in buttocks. Buttocks is ruled out. Okay. Right. So somewhere else, exclusion principle. So expected answer is lower back or leg or hip or thigh or calf or similar other region. So speaker clue, emotional marker. If the patient describes where the pain is, expect a natural body part in speech. Like, yeah, mostly in my lower leg or in the back of my thigh. Okay. In the back of my thigh. So watch out for compound areas, lower back, right thigh, left leg, compound areas. So two words together. So predict answer, lower back, right leg, left thigh, hip, calf, hamstring, foot, lower limb, like that. And brainstorm path for question 2. So it's very clear now. Question 1 is very, very clear. Okay. Now part of speech, noun. Part of speech is noun. Type, common, concrete, anatomical. And a number, likely singular or compound noun. Question number 2. So we finished question number 2. Now we are moving to question number 3. Yeah. So extracted question 3, context, pain described as. So this is a description. Pain described as, this is a description. Okay. As, the word as means is a descriptive word. As beautiful as clever as strong as white as dark as. So dark, okay, as many as much as big as small as. So all these are adjectives, okay, in the first degree, not as bigger, biggest, no, big, as clever as, like pain described as. Okay, so first degree, big, bigger, biggest, 3 degrees are there. First degree, pain described as tall, taller, tallest, like that. Pain described as intense, more intense, most intense. So it is first degree, intense. Mild, milder, mildest. Severe, more severe, most severe. So like that, 3 degrees will be there for adjectives. First degree is needed. So pain described as first type. So what part of speech is needed here? So described as means it is followed, always followed by a noun, adjective, or noun phrase. Described as a noun or an adjective as a noun phrase. So pain described as burning, it is adjective. Okay. Pain described as adjective, burning. Pain described as a stabbing sensation is a phrase, a noun phrase. Sensation with a stabbing. Stabbing is an adjective. A stabbing sensation. So it's a phrase. So listen very carefully. The next one, pain described as a sharp. Sharp pain. Pain described as sharp. It may be a burning sensation or a stabbing sensation or a stab sensation. Like that also they give. Or just a burning or sharp or stabbing. Pain described as stabbing. Like that also they can give. Anyway they can give. So be very careful. What type of answer is there? Is speaking there. A burning, a stabbing sensation, sharp. So a stabbing, a is there because noun is there. If noun is not there, sensation is not there, then a is not needed. So pain described as stabbing, pain described as burning, pain described as sharp. Pure adjective or participle like stabbing or burning. Okay, inform. Next one. What type of adjective or a descriptive phrase? So simple adjectives are dull, sharp, burning, shooting, and stabbing. So these are the ways to describe using simple adjective. Dull, pain. Pain described as dull, sharp, burning, shooting, stabbing. Then participles, throbbing, tingling, aching. Okay. So those are participles. The next one, compound descriptors. Electric shock like, knife like, cramping. These are compound descriptors. So next one, singular or plural. A, stabbing pain. Okay. A is article is there if pain is there. If otherwise no A, plural, sharp sensations. Plural is there. No need A. A sharp sensation or sharp sensations. No article there. Okay. It becomes a noun phrase. Sharp sensation. So described as. Next one, singular, uncountable. Now let us take some examples. Sciatica, burning, shooting, stabbing, radiating, electric light, throbbing, pins and needles, pricking sensation, tingling sensation. These are some nerve pain symptoms because this is related to sciatica. Emotional markers or speaker hints. It feels like, so he will tell, it feels like, I feel, I think, sometimes I feel, I'm upset, I'm worried. These are the emotional markers. He's telling his emotional feelings. So patients often use expressively and emotionally loaded words like, it feels like someone is jabbing me with a knife. It's like electricity shooting down. So listen for similes or metaphors. What are similes or metaphors? Like is a metaphor. Like is a metaphor. Like. So he is like a tiger. Okay, he is like a tiger. He is clever like a tiger. Metaphor. Like is a metaphor or simile. Okay, as means like means simile. Metaphor means Abraham is a lion in the school. Abraham is a lion in the school. This is not simile. This is a metaphor. Metaphor means he himself is a lion now. Like that, we are treating him. He's not like a lion, but he's a lion himself. So there is no difference between lion and Abraham like that. But in the simile, Abraham is like a lion, means similar to a lion. Not a lion, but he's similar to a lion. So comparing with a lion, that one. This is a metaphor, equating with a lion. Okay, that is similar to a lion. This is equating 100% a lion. That's all. He's a lion. Nothing less, nothing more like that. Metaphor. Simile means comparing. That's all. Next one. Burning, shooting, stabbing, radiating, electric, tingling, pins and needles, aching, sharp. These are some words. So adjective, descriptive phase, sensory, pain-related medical descriptors, singular and uncountable. Then pain quality, neural, static, sciatic pain. And burning, shooting, stabbing. So these are most likely radiating, electric, and tingling. These are most likely options. Next one, extracted. Question number 4, context. Mentions inability to dash as most frustrating aspect. So now you see as is there. So next adjective should come, frustrating. Okay, inability to. So not able to do something, not able to do something. Okay, not able to do something means what? Verb. What part of speech is needed here? Inability to do something. Inability to do something. After inability to, that means there's a base verb form. So that means V1. V1. For example, drink, drank, drunk, drinking. Do, did, done, doing. See, saw, seen, seeing. Base form is a C. Original. Okay. In base form C. So, inability to move, inability to bend, inability to walk, inability to sleep, like that. So, it's the base form. It is called infinitive. Infinitive. Okay. Now you add a to, it becomes infinitive. To infinitive. To drink, to jump, to sit. So it is infinitive. Now you are using to infinitive. To with infinitive. Okay. So what kind of verb is it? Physical action. Words are of 3 types. Verbs are of 3 types. What are the 3 types? Main verbs. Those are action verbs we call. Action verbs means do, eat, jump. These are action words. Okay. Put, run, sing, dance. These are called as action verbs. Next one are static verbs. Static verbs means helping verbs. And, is, are. They're static verbs. Okay. Pen is on the table. Is static. It's not action. It is there. It's static. It's not moving. No movement. First one is movement, action. Second one is no action, static. Okay. No action means static. So it is there only. It will be there only. Until you move it, it will be there only. That means no action. You have to put an action into it. Then only there is a change. Otherwise, it will be lying there only. So, is, am, are. These are called B forms. These are called B forms, static. Static verbs. These are called helping verbs, not main verbs. They can become main verbs also if there is no other main verb. If action verbs are the main verbs always. If action verbs are not there, Then helping verbs can become main verbs. So then these be forms can become the verbs. It is there. It is playing. So playing is the main verb. Is the helping verb. But playing is not there. It is there. So it is in static. So it is helping verb. It's not the main verb. Okay. So be forms. So be was been being, am were been being, are were been being, is was been being. So these are static verbs. So now you can understand. So those will not come here. It's an action verb, not static verb. Okay. So next one. The third type of verbs are possession verbs. Ownership. Ownership verbs. Ownership or possession. These are not action verbs. These are not static verbs, but these are, you can say, possession verbs. I have a house. Ownership. It's not action. It's not static also. I have. After sometimes I will sell it, so I will not have. But I have now. So it's ownership. I don't have afterwards. Have is not there. Okay. I haven't a house now. I have a house. I haven't a house. So before you had, so I have a house. Now I haven't a house. So have is the verb of possession. So those two types of verbs, these are also helping verb. These will not be used. And there are another type of verbs. Those are called modal verbs. Now, what are these modal verbs? Modal verbs are used to help you to assist the main verbs. For example, will, would, shall, should, may, might, can, could, ought, need, dare. So these are modal verbs. So those also will not fit here. So the action verbs will come here. So physical action, okay, which involves movement, okay, movement, right. What are movement? For example, some action. When you sleep, you're doing some action. That means you're sleeping. You're doing some activity there. Sleep is an action. From starting time to ending time, sleep is continuing. You're doing that action, that activity you're doing. Like playing, you're sleeping. He is sleeping. That means he's doing some action there, some activity. Sitting, he's sitting. That is also an action. Movement is not there, but sitting is there. No? You sat, you're sitting there still. After some time, you move. Okay, you sit, you stand. It's an action. Sitting means you're not sitting, so you will sit. That is sitting. You're not standing, so you're sitting now, or you are lying down, and you stand up. That is standing. So it's an action from different position to this position. Sitting position, sleeping position, standing position. You're changing the position to that position. Sitting. I am sitting. That means you are not sitting earlier. Now you're sitting. So it's a change of action. It's an action there. So these action verbs may be three types. One is movement from one place to another. So movement action verbs. So walking, standing, bending. Then resting. Resting is sleeping, sitting. Is resting. Relaxing, lying. So that is resting. Then next one, functional tasks. That are moving, doing some activity. You are not doing directly. You are sitting in the car and you are moving forward in a car. So you are driving a car. You are riding a cycle. Okay. There are some people who say, I'm driving a scooter. No, I am riding a scooter, not driving a scooter. Riding on, driving in. Riding on. You sit on the top and you do, that is riding. And you sit inside in the cover entirely. That is called driving. Okay. So there is a difference between riding and driving. So functional tasks, work, some activity you are doing, right? Driving, cooking. Okay. Movement is you doing some movement. Functional task, you are doing something on something else, cooking food. That is function. Okay, not movement. Walking, running, jumping. Okay, flying, these are all movement of you to another place. But function means doing a task. That is driving, cooking, working, writing. Not something is happening to you, but because of you, something is happening on something else. If you are driving, the car is moving from here to Hyderabad. You understand? That is function, activity, or actions only. The next, what type of thing is there? Is it okay? Now, emotional weight. Why most frustrating? Because it is unbearable. Daily independence. He is not able to do on his own everything. It's abstracting and it is repeating often. So that's why most frustrating. And it is abstracting. It is critical for the patient's work or routine, not allowing him to do his personal activity. So sitting, driving, bending, sleeping, working, walking. These walk, sit, drive, bend, sleep, work, or walk. These are the words that will fit there. Okay. Maybe turn, move, rise, all these are words you can take. Grammatical confirmation. Inability to sit, inability to drive. Yes, suits. So unlikely option. Okay, inability to do my duty is too vague. Fine. Sitting for long durations. Okay. Bending or twisting the back. Driving, especially long distances. Walking, standing upright, sleeping comfortably. These are contexts. Okay. These are sciatica effects. Then likely sit, bend, drive, sleep, walk. These are the pool which we can take the words. Sit, unable to sit, unable to stand, unable to bend, unable to drive, unable to walk. These are the options which we can select. Maybe some other options also, but I'm just giving you some words. Okay. So sleep. Sometimes in sleep, you change your position from left to right, or right to left, or bend forward, or move forward, or fold yourself, something like that. There may be any chance. While walking, also bend. Okay. Bend down, straighten up, turn, twist. All these things also will be there. Twist, turn, bend, straighten up. Those also words may be there. So these are some words, that's all. So summary. So it's a verb base form. Verb also base form. And physical action. Okay. Then inability to dash. Inability to move. Like most frustrating, resulting in most frustrating. And movements affected by sciatica. Sit, bend, drive, walk, sleep, stand. Most be options. Now next, going to the fifth question. Dash sensation. Dash sensation. Now what is this dash sensation? So sensation, very good. Dinu and Aisha, very good. Very good. So now go through the question number 5. Yeah. Dash sensation. It is coming before a noun. So what comes before a noun? For example, boy, clever boy, good boy. Boy is a noun. Okay, sensation is a noun. So take another noun. Boy, table, big table, small table, round table, green table. So what is coming there? It's an adjective. It's an adjective. What comes before? It's a descriptive verb related to sensation. What type of sensation? It must be a descriptive, describe what type of sensation it is. So it is most likely an adjective. Participle, acting as an adjective, maybe that also. Participle means burning, ing form. Okay. So what kind of adjective? Type of sensation in the cows. Okay, sensory adjective, burning, sensation, tingling, sensation, stabbing, sensation, electric sensation, cramping sensation, throbbing sensation. Remember these words. The later also. Okay. So pain adjective, shooting pain, sharp pain, radiating pain. Then neutral clinical terms. altered pain, diminished pain, deteriorated pain, abnormal pain, okay, increased pain. So it may be increased pain or decreased pain or diminished pain or modified pain or altered pain or abnormal pain or normal pain, anything it may be. So most probably neurological or sensory adjectives. Next, singular or plural. The sensation is singular here. Okay. Adjectives agrees with the singular noun. Sensation, not sensations. It is sensation, so singular. So, not a phrase like pins and needles, unless the full phrase is mentioned in a context. So, tingling, burning, numbness. So, numb sensation, pins and needles, related to sciatica, electric like shocks, cramping. So, these may be the options. Now, let us, it feels like pins and needles. There is a kind of burning in my legs, burning sensation. A tingling runs down the calves, tingling sensation. So whatever you hear, you have to catch that word. So tingling, burning, cramping, shooting, stabbing, radiating, electric. Or, yeah, adjective, sensory, neurological. Before sensation. Then sciatic nerve symptoms in the calves, tingling, burning, cramping, stabbing, electric, radiating. Next question, number 6. Occupation involves a travel and some manual work. Occupation involves a travel and some manual work. So you have to be ready for this one. What part of speech is needed here? It's a occupation. Definitely it's a role, it's a job, it's an employment, a profession, title. So definitely it's a noun. It's a noun. Profession, title. So for example, proper noun, Amazon delivery. No. Courier. Yes. Driver. Okay. Technician. Okay. Courier. Okay. Right. Then collective noun, staff. No. Doesn't fit. Material abstract. Irrelevant. Now concrete, countable. So these are the most likely chances. So singular noun is a singular noun. Maybe driver. Because so no article is used before. Right? Patient's job, one person, he is doing one job, so it will be definitely singular. But a or an is not given. If a is given, it can be officer, accountant, inspector. But a is not given. So you cannot say a, e, I, o, u like. A is a vowel sound. So next one will be pronunciation beginning. Consonant beginning. Pronunciation, consonant, pronunciation beginning. A, doctor. A is vowel sound. Consonant, doctor, da is consonant pronunciation beginning. So consonant, vowel ending, consonant beginning, sounds. Sounds, not letters. A doctor, a teacher, a driver. Remember that. So there also is benefit if a and an are there. Benefit is there. If an is there, an inspector, an engineer, an officer, an accountant, like that. So an, na is consonant ending, not like a. An, na consonant. So officer, vowel beginning. Na plus a becomes na. An plus o, na plus a, na. An officer, an officer. It is an officer, not officer, it's an officer. Na plus a becomes na, they join. Okay, into one group. Na plus a becomes na, an officer, an officer, an officer, an officer. So it becomes an officer, like na. A, na, officer. A, na, officer. Pronunciation is a, na, officer. An officer. So try to understand that very clear. So a and an also will help you. If a is there, consonant beginnings will be there. If an is there, vowel beginnings will be there. An engineer, an accountant, an inspector, an officer. But a is there. A doctor, a teacher, a driver. So like that, a carpenter. So matching there also, you will get a lot of help if a and are there. But a and are not given. That means you can get any beginning. It may be officer, it may be engineer, it may be doctor, teacher, driver. Any combination may be there. So no worry about vowel or consonant. All are alike here. Okay. So driver, technician, laborer, definitely singular only. A driver, a technician, a laborer, like that. So if you don't write A also, not a problem there. So involves travel, some manual work. Job involving travel and manual work. So some manual work, let us take travel based or physical tasks. Delivery driver, courier, field technician, salesperson, construction worker. Don't write capital letters in the middle of the options. Huh? Many people lose their mark because of capital letters. They don't even know that in the middle of the sentence, they should not write any capital letters. So you are not supposed to write capital letters. So construction supervisor, engineer, site-based, electrician, plumber, because they move from one place to the other place. Nah? Electrician, one job to another job. Electrician or plumber or mason or somebody else. They move from one place to another place. So moving. They eliminate sedentary office jobs. So speaking context and job frequency. I've been working as a courier for a few years. So courier. I'm on the road a lot, doing deliveries for some lifting. Okay. So you are delivery driver, delivery driver, courier, technician, field worker, sales representative, repairman. Okay, repairer, repairman, installer. So these are the things. Next. Question number 7. Application of dash providing some relief. Now, application of dash provided some relief. So he applied something and that gave relief. So some medication. Relief means medication, pain medication. Something in which form it is. So what is needed here? Part of speech. Application of something. Something means noun. Of is a preposition. Application is a noun. Of is a preposition. So noun plus of, preposition plus noun. So noun, preposition, noun, relationship. Okay, pen on table, pencil in pocket, like that. Book on table, like that. Okay, so noun, preposition, noun. That is the relation here, followed by a noun. Now, so the blank must be a noun, the thing that was applied. What was applied? What was the thing that was applied? So now what type of noun? Proper noun, unlikely. Voltaren, name brand, will not apply brand, will apply medicine. Okay, so no. So common noun, ice, heat, gel, cream, lotion, powder, anything like that. Anyway, abstract noun, therapy. So therapy, possible, if general term is used. Application of some therapy, heat therapy, okay, ice therapy, hydrotherapy, that means water therapy, or physiotherapy, some therapy, right? The next one, material noun, ointment, gel, compress, okay, cold compress, heat compress, or heat pack, cold pack, whatever. So, very likely, this may be possible. Next, singular or plural. So, application of something, followed by it may be singular or uncountable. Okay. For example, heat. Heat is uncountable. You cannot count one heat, two heat, three heats, four heats, like that. Heat is heat. It's uncountable. You cannot say one or many. It's a collection. That's all. Ice, uncountable. Ointment. Ointment, uncountable. You cannot say one ointment, two ointments, three ointments. No. One type of ointment maybe. Okay. One brand of ointment maybe. But like water. Water is, ointment is like water. Okay. Ointment is just like water. So ointment is not singular. It's uncountable. So 2 packets of ointment or 2 boxes of ointment. Okay, or 2 capsules of ointment, like that. But it's not collective, countable otherwise. So gel is uncountable. A compress. Okay, fine. So singular or uncountable, no. Contextual field, sciatica related. You'll use ice, heat, creams, ointment, and gel, cold pack, warm compress. So they provide some relief, not oral medication. Okay, because it is applied here. NSAID is already applied, no oral medications. So topical application or temperature therapy, likely. So I tried using ice, that helped a bit. They told me to apply heat packs. The ointment gave some temporary relief. Ointment, heat packs, ice. So general terms. So ice, heat, heat pack, ice pack, ointment, gel, cream, topical treatment, compress. So fine. So these are the words most probably. Then next, eighth question. Eighth question. So eighth question. Let us see here. Referrals. Dash briefly. Referrals. So name of the professional. Okay. Not name of the person, but name of the profession. According to his profession. Okay. Reference to maybe podiatrician, maybe ophthalmologist, maybe gynecologist, maybe neurologist, cardiologist, or a physician or a surgeon. So name of the profession will come. Professional name. Professional name, not profession. Professional name. Name of the profession. Okay. For example, dentistry is the field. Dentist is the name of the profession. Ophthalmology is the field. Ophthalmologist is the name of the profession. Remember that. Cardiology is the field. Cardiologist is the name of the profession. So remember that not the field is the name of the profession that is important. So referrals to, okay, referrals to. So which professional? First professional in which field? So what is the name of the profession? So it may be, so specialist in particular department or field. What is the job title? Surgeon, okay, cardiologist, or physiotherapist, something like that. So referral, so person or service. So Dr. Smith, no, will not different. Direct to Dr. Smith is what? For everything you'll know, there is some reason why you're, so he's a dentist or maybe something. So next one, common noun. Is not a proper noun, it's a common noun. Physiotherapist is a common noun. Chiropractor, GP, general physician, surgeon, like this, most likely. Abstract noun, therapy, no. Okay. Referred, physiotherapy, no. Physiotherapist, okay. Dr. Smith, no. If Dr. Smith is giving therapy as a physiotherapist is suitable, but Dr. Smith is not suitable, therapy is not suitable. Pain team, refer to a team. Okay. Physiotherapy team or pain team. So you can take that also is possible. So healthcare professional or department or team. So reference briefly. Okay. So multiple services will be there. So they may refer 3 times to 3 different people. What is the problem you don't identify? So you send to 3 different. For example, he has some trauma. So you send to craniologist or so some other specialist, right? So he doesn't reveal no problem in head. So he'll send to some other neurologist. So neurologist also says no problem in neurology. So somebody else, he'll send to a surgeon. So check, open, and see what it is. So 2 or 3 referrals may be there. So the field may be general practitioner, chiropractor, orthopedic specialist, neurologist, physiotherapist, pain clinic, spinal unit, like that. So a different referral made briefly. They sent me to a chiropractor at first, but that day, so speaker clue, real life talk. So that didn't help much. Briefly. So he was briefly there. It did not help him. That's why he came back and he was sent to another person. So they sent me to a chiropractor at first, but that did not help. So came back and told the doctor, no, that's not useful. So then again he will send to somebody else. Then again he will send to somebody else. If it is not working. So briefly saw a pain specialist, briefly, short time, right? Short time, briefly, at first, initially. Okay, initially, at first, briefly, in the beginning. So that is what the word is. Briefly. So short time, in the beginning. That was not till the end. After that, it did not work. So he was sent to somebody. Who was that? He was sent earlier. So next, the patient visited for a short time. Remember that. So chiropractor, physiotherapist, neurologist, GP, general physician, and pain specialist, osteopath, spine clinic. So these are all maybe chances. Next question, number 9. So last 4 questions. Further treatment, epidural injections. Let me prepare some tea. Okay. Go through this question in the meantime. Yeah. Yes. Now question number 9. Further treatment. Further treatment. Epidural injections. Dash electrical impulses. Further treatment. Epidural injections. Electrical impulses. So you can see there. Epidural injections, dash, and electrical impulses. These are the 3 lines. They are coming in line. Epidural injections, question number 9, and electrical impulses. 3 are coming in a line. So what you are expecting here? So there are treatments. First one is given epidural injections. Last one is given electric impulses. Second one is number 9. That is not given. So we have to find out. This is a parallel list, one after another. So meaning the blank must match the structure and category of the other items. So there may be 2 words. Okay, treatment types. Okay, so structure and category of the other items, or treatment types. So it must be a noun because these are injections noun, impulses noun. Epidural injections phrase, electric impulses phrase. So it's a noun phrase. Both are noun phrase. So here also noun will be there, noun phrase will be there. It's the name of a treatment and it is a compound. So common noun, yeah, physiotherapy, acupuncture, massage, maybe. Okay, so they are also treatment. Proper noun, brand name, no, not likely. Abstract noun, therapy, manipulation, possible. So traction, okay, material noun, possible. So common noun or abstract noun denoting a therapeutic method. Okay, now let us see epidural injections and electrical impulses. Are they singular or plural? They are plural. So the blank should also likely to be plural. Or it refers to an uncountable noun also. Uncountable where plural is not chances. So for example, physiotherapy is uncountable, na? Okay. So plural noun, massages, treatments, but uncountable noun, physiotherapy, hydrotherapy. Okay. Physiotherapy, hydrotherapy, or any other therapy, whatever it is. Okay. Then next one. What treatment are used for sciatica? Manual therapy, physiotherapy, acupuncture, okay, massage, manipulation, traction, TENS. TENS means transcutaneous electrical nerve stimulation. May be covered by electrical impulses. Okay, likely something in addition to epidural and electrical methods. Right. I also had a few sessions of massage. So massage. They tried some manipulation techniques. So manipulation techniques. Physio was included along with injections, physiotherapy. So the blank likely names something done physically, non-pharmaceutical. Okay, non-pharmaceutical. So massage, physiotherapy, manipulation, traction, acupuncture, hydrotherapy, chiropractic sessions. So anything like that. So next question number 10, last 3. Last 3. Brainstorming blueprint. Brainstorming blueprint. Yeah. Decided not to try. This is also line of treatment. Decided not to try something. Okay. Not to try some type of treatment or method or option. So what parts of speech is needed here? Not to try something followed by noun or gerund. So intervention or treatment or method. Okay. That's very clear. So noun. Not to try surgery, injections. A verb plus ing form, swimming, stretching. Okay. Some exercises. So it's most likely a noun. So now what type of noun it is? Common noun, surgery, common noun, yeah. Acupuncture, yes. Proper noun, unlikely, unless named treatment, no. So abstract noun, therapy, yeah, possible. Right, physiotherapy, no, maybe. Not interested in physiotherapy. Did not want to try physiotherapy, maybe. Sure. Or hydrotherapy, maybe. Right. Decided not to try typically refers to a singular or uncountable noun, not to try surgery. Surgery. Surgery is uncountable. A surgery, 2 surgeries, 3 surgeries, 4 surgeries. No, surgery. He underwent surgery 4 times, not 4 surgeries. He underwent surgery 4 times. Okay. You cannot say 4 surgeries. He underwent surgery 4 times. Remember that. Physiotherapy, uncountable. So, or singular also is expected. So, surgery, acupuncture, chiropractic treatment, steroid injections. Okay. If already had epidurals. Alternative medicine options. So, he did not want to try. So, not considered, did not consider, refused, declined. Such words. High probability. Surgery is a high probability candidate here. Right. So, I was told about acupuncture, but I did not feel comfortable trying it. Not decided, not comfortable, not accepted. They suggested surgery, but I didn't want to go that far. They suggested surgery, but I didn't want to go that far. That means they suggested, but I did not accept. That's about. Okay, don't want to try. I was told about acupuncture, but I did not feel comfortable trying it. So somebody saying and somebody negating. That's the important thing here. The patient said it is his decision, patient's decision. So whether he said yes or no, that you have to see. Then only you can confirm the answer. Conversational rejection. So somebody says and he will reject. That's it. Somebody suggested and he rejected. So common but invasive option. Surgery, most likely. Acupuncture, chiropractic treatment, traction, nerve block, alternative therapies, manual therapy, all these things. And question number 11. Patient attributes recovery to what type of treatment? Same line, going on, treatments line. So, recovery to what? What type of treatment? What type of action? So, patient, what part of speech is needed here? To something. So, it's a noun phrase. Attribute to something. Recovery to something. Recovery to something. 1 minute. Hello? Hello? Urgent? Class. Live class. Yeah. Sorry, it was my wife. So, attributes recovery to dash. The phrase attribute to always followed by a noun or a noun phrase. The cause or factor credited. Attributed means because of. Because of. What is the reason? What is the factor? What is the cause? Because. So he recovered because of steroid treatment. Okay, steroids. He recovered because of surgery. He recovered because of acupuncture. He recovered because of traction. Whatever. Okay. He recovered because of alternative therapies. All the therapies together, acupuncture, anything may come here. He recovered because of something. What is the reason for his recovery? What is the cause of recovery, which made him recover fast? So next one, positive influence. Exercise may be one, right? Okay, other than treatment. Rest may be also right. Discipline, lifestyle change may be right. Chances are there. Exercises like stretching, walking. Maybe because of that he recovered, right? Then next one, singular focus. Or maybe combination of things also. There may be a combination also. There may be joint effect. All together made him recover. Rest, physiotherapy, medications, treatment, everything together. Maybe that also is possible. So primary factor may be there. All together also may be there. So physiotherapy, exercise, stretching, rest, lifestyle change, posture correction, persistence, patience, diet change, aerobic activity, self-care routines, combination of all the things, or collective effort, everything. Typical real life phrase. Honestly, I think what really helped was doing daily stretches. So stretching, daily stretches. I feel like walking every morning made the difference. Walking. Just keeping active seemed to work best, keeping active. So try to understand what he's telling. Listen to that one. Any answer may be right there. So you have to be ready with that particular answer. So next, 12th question, last question. Previous diagnosis, sciatica probably related to previous diagnosis. Okay. What part of speech is it? Related to something. Sciatica related to something. So now, relation with something. Relation is something with something. Sciatica and something else. So what is it related to? Noun, cause, origin, or associated condition, underlying anatomical, medical, or physical cause of the sciatica. Common noun, posture maybe, condition maybe, injury maybe. Abstract noun, strain, misalignment possible. So medical noun, disc herniation, nerve root compression, definitely possible. But proper noun, unlikely. Right. So the phrase related to typically takes a singular or uncountable form. So related to posture, related to nerve damage, related to disc compression. Okay, disc or compression. So herniated disc, poor posture. Okay. Or spinal misalignment, degenerative disc disease, trauma or lifting injury, or piriformis syndrome. So these are some examples. No history of pain in buttocks. So piriformis is unlikely. Okay. Pain in the buttocks, then piriformis. So speaker clue. They said it's probably due to the slipped disc. So slipped disc is the answer. They think it's related to a pressure on the sciatic nerve. Okay. So sciatic nerve is the answer. It might be caused by the poor posture over the years. Poor posture. So try to understand. So diagnostic or anatomical type. So disc herniation, nerve compression, spinal misalignment, posture, lifting injury, pressure on nerve, vertebral issue, spinal degeneration. These are the models. So mission accomplished. So are you able to unmute and speak something, whether you understood or not, at least now? Yes. So if you are able to unmute, you can unmute and tell me how you felt regarding the session. Yes, please. Aisha, can you speak one or two sentences? Please. Dino? Dinukshi? I am at work, sir, maybe, right? Okay. You are busy at work, huh? Okay, fine. Understand. So what did you understand? How did you understand? Give a small feedback, right? Okay. So that is how you have to do part A. That is how you have to do part A. Okay. So both are only messaging, so not able to speak. So you can message me personally on WhatsApp. Okay, why you are not able to speak? What is the condition? Busy or what? You can write in my WhatsApp. Okay, so that's the end of the session. If anyone is interested, you can contact me on my number +91 98 778 67360. We are going to take 4 places for nurses and 3 places for doctors. So new batch starting because students have finished their exam. So contact details. Okay. +91 98 778 67360. This is my number. You can contact me on this number. Yeah, contact the admin. So Peter Simon. GrandMasterClass. Yeah. So contact +91987780 I repeat 9877867360. Yes, please. So that's the end of the session. If you're interested, you can contact me. Simon Peter is the name.